I'm Siona Bose. Welcome to my channel, Learning Builds Life. Today we are going to talk about the classification of bones, but this is developmental classification. Previously, we did according to shape, like the long bones, the short bones, the flat bones, the irregular, pneumatic, etc. Today we will discuss about developmental classification. Developmental classification. So let's begin. Firstly, we have membranous ossification. Ossification. Now, what is ossification? Ossification is the development of a bone from any kind of medium. Like previously, we had discussed that accessory bones were ossified from ununited epiphyses, which later on became separate bones, and that happened from ossification of the epiphyses' first tissue form into a hardened bone. Membranous ossification means the bone has ossified from a membrane or a mesenchyma, which is a type of animal tissue. Similar like epithelium, that is another type of animal tissue. Mesenchyma over here. Ossifies membrane. Membranous or mesenchymal, as I said. They condense from a mesenchymal tissue. Mesenchymal tissue. Examples are the bones of the cranium, like the frontal and parietal, cranium, and facial maxilla. Let's revise that one more time. The membranous ossification means the bones which develop that ossify in membrane, that means membranous or mesenchymal. They condense from a mesenchymal tissue. Example, the frontal and parietal bones of the cranium, and the facial bone maxilla. The next one is cartilaginous ossification. These bones ossify from cartilage. These bones ossify in cartilage. That means intracartilaginous. or endochondral ossification. Ossifies in cartilage, that means either intracartilaginous or endochondral. These are two names we can use. Now, examples are the long bones humerus and femur. And there are many more, of course, but examples. Let's revise that one more time. Cartilaginous ossification ossifies in cartilage. Intracartilaginous or endochondral ossification. Examples are humerus, femur, etc. Now you may take a look at the board. Let's continue. Now we are doing the membrano-cartilaginous ossification. The membrano-cartilaginous ossification means it half ossification from membrane, half membrane, actually half intramembranous, and half cartilaginous, intracartilaginous. Ossification. For example, the clavicle or the collarbone. Clavicle, collarbone. The sternal end, that means the end facing towards the sternum or the breastbone, sternal end ossifies endochondral. That means cartilaginous. And the rest of the bone is intramembranous. It's intramembranous ossification. Intramembranous ossification. Now we can take a look at that again. Membrano-cartilaginous ossification, half intramembranous and half intercartilaginous ossification. Example, the clavicle or the collarbone present here and this side. Sternal end has endochondral ossification and the rest of the bone is intramembranous ossification. Moving on to the somatic bones. Most of the bones are somatic. And now what does somatic mean for bones? Most of the bones are somatic. Well, what does somatic mean in case of bones? Somatic in case of bones means it's like having, like previously we discussed about the definition and composition of bones, and we came to know that there was a percentage of connective tissue. The bones which mainly consist of connective tissue are the somatic bones. And lastly, we have visceral bones. Some bones develop from the pharyngeal arches, develop from pharyngeal arcs. Now, what are pharyngeal arcs, you must be wondering. These are some structures present in the embryo from which several structures develop. Some bones develop from pharyngeal arcs, and the examples are hyoid, mandible, occipital, sphenoid, and temporal. Now you may take a look at the board. Moving on to regional classification. Now we have regional classification. Now, there are two components in regional classification, the axial skeleton and the appendicular skeleton. We had discussed this previously too. Axial skeleton. This consists of the skull, vertebral column, thoracic cage, and thoracic cage actually. And thoracic cage. The axial skeleton consists of the skull, vertebral column, and thoracic cage. Then we have the appendicular skeleton. The appendicular skeleton, top to bottom, consists of first the pectoral or shoulder girdle, pectoral girdle actually, but shoulder girdle, pectoral or shoulder girdle. Then we have the upper extremities, then we have the pelvic or the hip girdle, we can pelvic or hip girdle. And we have the lower extremities. We can have a short revision of regional classification. Regional classification divided into axial skeleton and appendicular skeleton. The axial skeleton consists of the skull, vertebral column, and thoracic cage, and the appendicular skeleton consists of the pectoral or shoulder girdle, upper extremities, pelvic or hip girdle, and lower extremities. Now you may take a look at the board. Hope you enjoyed this episode, and please like, share, and subscribe my channel, and stay tuned for more videos. Thank you!